Hello, welcome to Afya Dynamics, a user-friendly system to help manage your facility. And the way we build this system is that we build it in such a user-friendly manner that we would like you and I to train together through these videos so that you can be able to use the system even when our team is not around. So throughout this whole series, I'll be guiding you on how to actually use the system to the benefit of your facility and how to use it correctly. That being said, let us start with the first point of the patient interaction that happens in a facility. So I'm going to show you through a series of steps how you can create a patient, how you can start a visit for that patient, and the basis of the patient file. We call Afya Dynamics a very patient-centric system in that it's built around the patient file. Just in the same way, in a hospital, the patient file is pivotal to patient care. So all the information about the patient is stored in the patient file, and that is how Afya Dynamics is built. So to add a patient, you need to go to the clinical module, click on the clinical module, then click on add a patient. It will take you to a step-by-step guide on how to add the patient and the data that is required. On step 1, you'll require to add the biodata of the patient. That means you'll need to add the information about who the patient is and their sex and their age and things like that. So first, you'll add the name of the patient. That includes all 3 names, first, middle, and last. Then you'll add the sex of the patient and the date of birth of the patient. Then you will get to add the the phone number of the patient and their email address if provided. Then you get to add their ID number, that is if it's a military ID, civilian ID, or a passport for billing and insurance purposes. Then after that, you get to add their residence, which is integrated with Google Maps to ensure a very accurate recording of the patient's residence. After that, you get to select where the patient heard you from. That is for marketing purposes. Did they hear from a friend through social media, through Afya Dynamics marketing your facility? How did they hear about your facility? That's the end of step 1, and you click save and continue. On step 2, you'll be required to put in the next of kin or the emergency contacts of this patient. So you'll put in their name, their relationship. Is it a mother? Is it a child? Is it a brother, an uncle? What's the relationship between the emergency contact and the patient? Then you go ahead and input the phone number and email address of the emergency contact. At this step, you're presented with 3 options. That is, you can just save the patient outright, and that means they'll enter into your records for future use. 2, you can save a patient now and create an appointment for later for the patient. Or number 3, which is the most likely scenario, is you save the patient now and you start their patient visit right now. So if you start the patient visit right now, you'll be taken to the next step, which is step number 3. In this step, you'll select details about the patient visit, starting with the visit type, that is it outpatient, inpatient, or continuous treatment. Number 2, you'll select the visit type. Is it CCC? Is it MOPC? Is it SOPC? What kind of patient visit is this? Or is it general patient? Number 3, you'll select the clinic room that this patient is going to. Is they going to clinic room 1, clinic room 2, Dr. Vyambo's office, or Dr. Nancy's office, depending on the selection that on the day's duty rosters. Then number 3, you'll select the patient, the doctor that they're going to see, also the triage nurse that they might be seeing to take their triage results. Then finally, you can attach this patient to a corporate or a referring clinician or a consultant for easy record keeping. So when you start the visit, the patient file is automatically open now, and on the patient file it contains all the modules and the things that might be done to the patient. So starting with, on the top left corner, you will see the patient biodata. It's their name, their phone number, their age, their sex. It will be on the top right. Then on the top left, you'll see general functions for the patient file. Then you'll also see different readings for the patient vitals, always shown on screen on the patient file so that you can know what is happening with the patient at all times. Then after that, on the bottom left hand menu side, you'll see a pink menu. That menu has all the functionalities for Afya Dynamics and all the functionalities that relate to the patient file. So on that menu, you'll be able to open the different areas that allow you to access the patient file and the different modules that relate to the patient file. So thank you so much for watching and for creating a patient. I hope that we have been as explanatory as possible and that you will find it easy to actually register and create a patient on Afya Dynamics.